as I've asked the question, what is money? As I've studied Bitcoin, I have come across the field of Austrian economics and the idea of human action and free markets, and where possible, enabling free markets to exist. An area like what you're describing here is full of interventions, whether that be the medical system itself or government trying to fund it. And when you see a lack of beds or whatever the bottleneck might be, why can't the free market just solve that problem? What are the hurdles in the way for that to actually happen?
Yeah, I mean, that's a very good question. I am also a believer in free markets, but free markets don't necessarily work very well in providing essential services.
Mm.
And one of the issues we have in the Bitcoin community is that most of us are sort of libertarian, ultra capitalist leaning. And that's okay. But I mean, the health system in the US is a lot more free market than it is here, but their outcomes are significantly worse than what we have here at a population
Wow,
level. And that's because
interesting.
when you're trying to provide an essential service, such as healthcare, and you leave it up to the free market, that leaves it open to abuse because the free market dynamics that determine pricing um, are easily abused when the service that you're providing is literally life saving. And so that means that you can charge an extortionate amount, or you can manipulate the free market system to charge an extortionate amount, or restrict access to only those that have that money to pay you. And so somewhere like the US, where it is a lot more capitalist in the way the health system is designed, they end up having higher prices for things than you would otherwise expect. And the access ends up being even more limited than you would otherwise expect. And so
Interesting.
that's one issue. In a market like ours in Australia, where it's about 50-50, which is pretty optimal, you sort of want the public sector and the private sector to be duking it out and both competing and complementary in the delivery of service. The way that works is that both sectors, the public and the private sector, allow for venting from one system to the other as required. So they actually compete against each other, which is also a free market dynamic. It's just it happens to be between the taxpayer and the insurer sort of thing, or between the public sector and the private sector. So as an example, if the private sector were to begin extortionately charging high prices like they do in America, a percentage of the public will just default to the public sector where they can get free healthcare, albeit at perhaps at a lower quality. Alternatively, if the public sector slows down a lot like it is now, then the public has the option to pay more and go to the private sector. So it has this function of balancing things out where the consumer actually has a choice between a private market and a public market, as opposed to in some places like the NHS, which is almost all public, and the US system, which is almost all private. And when you have that setup, it doesn't function as well because you don't have as equal a choice as a consumer to move between the sectors. Now, one of the issues we have in Australia at the moment, which is a fairly recent problem, is that a lot of the private healthcare providers are beginning to struggle financially. So I think you're in Melbourne, aren't you, Jake? Is that right? So there's
I'm
a
actually in Byron Bay now, but
Byron Bay.
yes, I
Okay.
was in
Well, when
Melbourne
you were
for a
in
long
Melbourne,
time.
yeah. So HealthScope is a big private healthcare provider that runs a whole bunch of private hospitals around the country, a few in Melbourne, in Adelaide, and other places. And they're, at the point where they're fiscally doesn't really make sense to continue their enterprise. So they're losing more money than they're making. And the reason that's happening, I believe, is because only one party, when you compare the public and the private sectors, only one party has a money printer, the other one doesn't. And so when the public sector becomes relatively dominant and relatively fiscally irresponsible and prints a whole bunch of money, and increases the prices of delivering healthcare beyond a sustainable limit, the private sector struggles to make a profit.
To those listening out there, we had some connectivity issues. So what we'll try and do is pick up the conversation roughly where we were. We were talking about a number of different realities when it comes to how to provide healthcare and the nuance between a public funded organization and a private funded organization, and the reality that you see in the United States, where actually, because of something genuinely being life saving, the provider of that service, and it's an acute demand, an acute problem, could charge an extortionate amount of money. And therefore, like, how do you draw the line? What becomes abuse or what doesn't? So a fascinating ethical conversation. But it's intriguing as well to then overlay that with the different bottlenecks that you've already described about how, like, there might not be enough beds, or there's not enough ambulances, or whatever the nuance might be. So is there a solution to this, Tarik?
Yeah, well, I mean, it might seem like an impossible task, but in reality, even within our own countries, it wasn't always like this. So
Mm,
if you go back to the 40s, 50s, 60s, we seem to be able to deliver the healthcare and pay for it with our own resources. Um, a lot of the aspects of healthcare, like a lot of technology, should be deflationary. So things should be getting cheaper. Certain aspects of healthcare technology should be getting cheaper. We should be becoming more efficient at delivering healthcare using these technologies. So, yeah, is there a solution to this problem? I think there is. I think it would involve, sound fiscal policy, sound monetary policy, which would have a few effects. The first would be that the rate of inflation of healthcare pricing would be tempered and would be reduced. But secondly, allocation of funding. So at the moment, the way the monetary system works is a whole bunch of money that the government has, either printed or through revenue, that they distribute. And the distribution mechanism is top down through reserve banks, followed by retail banks, followed by everything else. And so a lot of the monetary energy is being dispersed in ways where we as citizens may not be happy with. That includes funding things we don't want them to fund, but it also includes the sort of Cantillon leak that happens. So, where banks seem to be making billions of dollars of profit every year, real estate agents seem to be making millions of dollars of profit each every year. All of this financial energy could be reallocated in a way where we pay for things that we want rather than in relation to proximity to the original money printer in terms of how the money
mm,
is distributed. And
mm,
so I do think there's enough money to pay for healthcare. I just think that inflating the price of healthcare astronomically and then allocating an extra 3% a year in the budget is not the way to do it.